All right, welcome back to the IndeVets Happy Hour. I am your host, Dr. Andrew Heller, DVM. I'm here with my co-host, as usual, Marisa Brunetti,
VMD.
I had to point to her this time. She didn't get my cue. Well, today we have a really awesome podcast to talk about. We're taking a little break in our pearls, and we're going to just fill the audience in on a few new products and services that are coming our way in the vet space. And to join us, we actually have three of our own IndeVets here to talk about them. Some of whom have been on the show.
Special IndeVets.
Oh, very special. A couple of them have been on before, but we do have a newcomer, and I'll introduce them all one by one. So first up, we've got Kelly Dunham. She is actually the area medical director at IndeVets up in New Jersey, New York. Kelly, welcome. How are you?
Good. How are you?
I'm great.
Great to see you again, Kelly.
I'm about to crack open my beer to drink with you all.
Oh,
Ooh,
nice sound effects.
Yeah. We'll talk about what we're drinking in a second after we introduce everybody. The second person I want to introduce is Dr. Amy Lloyd, the area medical director on IndeVets team here in Pennsylvania. Welcome, Amy. Welcome back, I should say.
Mm-hmm.
Thank you. I'm happy to be here.
Hasn't been too long since we saw you. And finally, but certainly not least, Dr. Anita Patel, our area medical director in the South, in the Atlanta, Georgia region, as well as the Carolinas. How are you, Anita?
I'm doing great. How are you?
Doing great.
He's always great.
All right. So everybody, now we can talk about what we're drinking. So I'll start since mine is so delicious. This is a Tired Hands beer. It's a lychee milkshake IPA. So I guess what makes it a milkshake is they use lactose as the sugar.
It sounds real bad to my GI tract.
That's good stuff.
And Tired Hands is where?
Tired Hands is in Ardmore, Pennsylvania. It's actually right around the corner from my house.
Yeah, it's a great place.
What are you having?
So Amy and I are both drinking Trogs. This one is Nugget Nectar, which is like their springtime one that I love. And if you don't go get it right now, it's going to be sold out in 2 weeks. I'm just telling all of you guys. So, and Amy, which one are you drinking?
I'm drinking Grand Cacao, which is a chocolate stout, and it's perfect for winter since it's still sort of winter.
It sounds delicious.
Yeah. So we've got a few things to talk about that are new in the industry, which we're going to get to in a second. We always like to talk about who this is intended for. I think we should all agree this is mainly for vets today.
And vet techs and managers, I would say.
Yeah, that's what I was going to say too. And as usual, we always welcome pet parents out there who are just interested in learning about what we do as vets and how we use some of these technologies and treatments.
I definitely think for the manager side, especially for the tests that Amy's going to talk about, making sure your hospital is set up to be able to order the test beforehand. So it's not annoying to your doctors to like scramble when they want to run this test in the middle of their day.
Yeah. All right. So first up, we're going to talk to you, Kelly. Tell us about the new pharmaceutical drug that is hitting the market.
So Solensia is a new monoclonal antibody injection that's coming out for treatment of osteoarthritis in cats. It's super cool because we really don't have a whole lot out there to treat arthritis or pain really in cats. So it's really exciting. It hasn't been released in the US yet. It is already out in Europe, but we should be getting it later this year.
Yeah, we already hunted down Zoetis to ask, right?
Yes.
So it's hitting the market later this year. So how do you use it?
So Solensia is a sub-Q injection, and it's dosed at 1 mg per kg, and you round it up per vial, really similar to how you do with Cytopoint. Once you puncture the vial, you need to discard the rest of it. So there's no using partial vials in this medication. There's no preservative in it, so it doesn't stay good once you puncture the vial. And basically the way it works is that it binds to nerve growth factor, which helps to reduce signal transduction involved in pain.
Is this mainly indicated for older cats? I mean, obviously for osteoarthritis, we see that more in older cats.
Yeah, it tends to be more in older cats, but you can use it in any cat more than 7 months old and more than 5.5 pounds.
Awesome.
And I know it's labeled for osteoarthritis, but my guess is I'm sure this will extend to other forms of pain in cats. What do you guys think?
I imagine it will. I hope so.
I hope so too. I really do.
So Kelly, are there any contraindications when using this drug?
Yes. So Solensia cannot be used in pregnant or nursing queens. And people who are handling the drug who are pregnant or nursing should use caution in using it as well, since nerve growth factor is vital for fetal development. So you should just make sure to use extra caution or have someone else handle the drug to give the injections.
And is it safe to use with other drugs?
So they're still doing studies on its use in conjunction with other medications. Right now, they're focusing on its use with NSAIDs, but it has not been fully evaluated yet.
I hope it's like Cytopoint and you can give it with anything.
I hope so too. And it does last for a month in their system, similarly to how Cytopoint does.
Oh, that's great. I forgot about that.
So you're just giving it once a month?
Yes.
Nice. Okay.
The only other thing I wanted to point out is that if you go on to Zoidis's website about Solensia, there's lots of great resources for clients and for staff members. There's a really nice walkthrough that you can do. It's a questionnaire where you can kind of determine if your cat is exhibiting signs of osteoarthritis. And it's a lot of those things that clients might see, but not always think to register as maybe my cat is painful. Like maybe my cat's not jumping up as much as we used to, or maybe they're staying away more. So after having that initial conversation with the client, it's a nice resource to direct them to.
Great.
It's a great point. Yeah, because cats really are great at hiding their pain.
Yes.
Right? We have to be very diligent. No, they don't. No, they don't. All right. Well, we will keep you guys updated out there for when we know this is coming. And hopefully we can do a much deeper dive once we actually start using it and seeing how it works. Thanks, Cal.
Thank you.
Perfect. So, Amy, let's bring it over to you. You have not a drug to discuss today, but more of a test. Tell us a little bit about the new Vet cancer screening.
So I'm super excited about this test. Anita has actually used it. I have not, but it is the first simple, affordable, accurate ELISA cancer screening test in veterinary medicine. And it is simply a screening test. It doesn't identify a type of cancer that may be present, but it identifies risk. The way it works is cancer cells release nucleosomes into the blood. Nucleosomes are bead-like structures composed of DNA coiled around a histone protein core within a cell's nucleus, and since the cancer cells are more friable, they release these into the blood, and they are then measured using antibodies specific to the nucleosomes themselves. It's super interesting because it has a 97% specificity rate for cancer, and it detects 77% of lymphomas and 82% of hemangiosarcomas, which together represent about 1/3 of all cancers in dogs. Because it looks at systemic types of cancer, it may also detect some instances of mast cell tumors and histiocytic sarcoma because they can be systemic as well.
Wow. So how do you use it?
So it has a lot of applications in private practice. You can use it during senior canine wellness exams as a screening test. You can use it in cases where you suspect neoplasia. If you have that older German Shepherd that you just feel has cranial organomegaly and you're not really sure and the owner doesn't want to go for an ultrasound, you can use it there. In younger dogs, if the breed or line has a high incidence of cancer, so once again, breeds like German Shepherds and Golden Retrievers, where people might know they have a high incidence, Rottweilers, all those breeds that we see a lot of lymphoma and hemangiosarcoma in, especially when owners typically might say, I'd like to do an ultrasound at 8 years, or you might say, I'd like you to do an ultrasound at 8 years. Instead, they can do this test that's much less expensive if they don't want to put the dog through an ultrasound. This is just a simple blood draw.
Any idea how much it would cost?
Anita can answer this better than I, but I feel like it was costing somewhere between $150 and $200 at most hospitals.
Yeah, that's been my experience.
Are there any particular instances where you should avoid using this?
Yes. First of all, you have to make sure the dogs are fasted, as the nucleosome levels in dogs that are not fasted may be elevated compared to fasting samples. I don't understand why, but that is what the company says regarding this test, that it will not be as accurate. And then the other reason would be if they have immune-mediated disease, systemic inflammation, sepsis, severe trauma, or another severe inflammatory disease, that can actually cause elevated nucleosome levels as well, and your test result may not be accurate.
So I understand it takes a few days to get the results back, right? So it's not something you can use on an emergency basis either, right?
Correct.
Yeah, and there's very specific ways to take and handle this blood for testing, right, Amy?
Yes, you're supposed to collect the fasting blood work. The fast doesn't have to be long, at least 4 hours. And you take 1 to 3 mLs of a whole blood sample in a lavender top tube and then centrifuge that for 10 minutes within 1 hour of collection. That's very important as well. If it's left out to sit, the results will not be accurate. And then without disturbing the buffy coat, you transfer the plasma to a sterile red top with no additive, and that gets sent not frozen, but cold, has to be received within 72 hours of sample collection at the GI lab at Texas A&M.
And that's typically probably FedEx, right, Anita? I'm trying to think to get it there.
If a clinic has an account with the GI lab at Texas A&M, you can get like a reduced shipping label. And I think it's like $15 to overnight it to Texas A&M for the client. And it's, I'm pretty sure that's FedEx.
Okay.
And also, when I was mobile, I sent things to Texas A&M as well. And even as someone who would send things relatively rarely, I did just go to my local mailing place and I sent it through FedEx, and I just followed all the instructions and sent it out. And it works out. There's so many ways to get things to Texas A&M.
Good.
So is this an easy product to incorporate in your practice if you're an owner out there and you're interested in this?
I think it's a very easy product to incorporate because there's really no outlay for it. You use it as you need it. You don't have to do anything special. Everyone has lavender tubes. Everyone can draw blood. Everyone has a centrifuge, and everyone has sterile tubes with no additives. So it's very simple, and we all have ice and packaging.
Hopefully.
Yeah. Well, I love how they're coming up with so many great ways to, detect cancers earlier and earlier these days, and certainly promising not just for pets, but, for people too. I know there's a lot of these types of products on the market.
And I think this one is especially important because how often do we hear our clients talk about, like, is there a blood test for cancer in dogs?
Yeah.
And we're like, no, there isn't. It's not like humans. Like, we're just doing the basics. But now you can say, like, for these 2 specific cancers, there is a screening test at least. And I think a lot of people will take advantage of that, at least, 8 years and above, or maybe, earlier if they need to.
And just out of curiosity, it doesn't differentiate between the types of cancers, does it?
No, it doesn't. It just says that there's risk. It doesn't even say for sure that there's cancer. So they report this in a really helpful way. And what they do is they put the dog in a risk category because this test is all about just looking at risk and not looking at a type of cancer. And so there's one level that's low risk, and that is consistent with levels of nucleosomes found in healthy animals of all genders over the age of 1 year. Then there's a moderate risk category. And in the moderate risk category, if the patient is otherwise healthy, they're recommending repeating the test in 1 month. If the patient doesn't seem healthy, then I would assume that that would bear more testing depending on your clinical feeling, especially because this is a new test. Then there's also the moderate to high risk and the very high risk. At both of those levels, they say that it's consistent with nucleosome levels found in common canine cancers, including lymphoma and hemangiosarcoma, and they do recommend further workup to better elucidate what is happening with that pet.
Great. Is there anything else you want to talk about with this?
I don't personally. I'm very excited about it because I have been practicing for quite a while and have never been able to say that there is a blood test for cancer. And it gets very exhausting to say to owners over and over, no, there's no blood test. You have to go through all these things. So just to be able to say, well, we can do this and we can see if your pet is at risk, at least for the systemic types of cancers, I think is great. And I really think this is something that can be incorporated into senior wellness, especially for breeds that are more predisposed to lymphoma and hemangiosarcoma and mast cell.
Yeah.
That's great.
Great points. That's awesome. Thank you, Amy.
You're welcome.
Yeah.
All right. Well, we're going to take a quick break, but we'll be back in a minute with Dr. Anita Patel to discuss a new drug for chemotherapy-induced diarrhea.
I'm a veterinarian, sure, but I'm way more than that. I'm also a tango dancer, a struggling but determined pie maker, and a mom. With IndeVets, I get to choose when and where I work. I create my own schedule and choose shifts at nearby animal hospitals that are right for me. Having that flexibility is exactly what I need to have plenty of time for all those other things that I am. Because I'm more than just a vet. Visit IndeVets.com to learn more and apply.
So, all right, Anita, you're up. We're going to talk about something called Cannilivia. Tell us a little bit about this product.
So Cannilivia, the active ingredient is crofelemer, and it's basically extracted from the sap of a tropical tree. They do have a drug out for humans that's being used for like HIV/AIDS patients that are on like retro antiviral therapy. And it's in those cases, it's actually being used for like weeks at a time. And so it has been out on that market, even though Cannilivia is not currently out for veterinary use at this point. Cannilivia, it's nice because it's basically just locally active. You're not systemically absorbing it. Traditionally, when we're treating chemotherapy-induced diarrhea, which is what this drug is being used for, we're reaching for things like metronidazole or, propectolin, probiotics, things like that. And then things like loperamide and things like that are going to start to affect motility, which can also affect appetite. So you just get a lot of side effects that are potentially going to be systemic with those products that you don't necessarily have to worry about with this. Its primary method of action is basically acting on chloride channels to help decrease the movement of chloride ions into the luminal part of the GI tract. And then if we are decreasing the movement of sodium that's following the chloride, you're also going to decrease the movement of water into the lumen. And so you'll basically locally control the diarrhea without having the systemic side effects necessarily that you would see with some of the other medications we typically reach for.
Great.
And I think, we were talking about, like, could you use this for any other type of diarrhea? And I think you had mentioned, like, if it's secretory, but then it's like, how do you know?
Yeah, and they definitely don't recommend using it. Like, if there's any potential for infectious diarrhea, it's not recommended to use this. So I think as of right now, it's pretty specific for when we know we're having, secretory diarrhea, like in the case of chemotherapy-induced diarrhea.
Based on the studies, how well does this work? I mean, is it very promising? Is it out yet, by the way?
It is not out yet. They do have a link directly on the website where you can order if you're a clinic, but on there it still says they're working on getting it out into production and selling to clinics. I think the hope is by the end of 2022, we'll have it where it's basically available to the masses and maybe not necessarily to just like oncologists or specialists that would be using it. As far as efficacy, 9 out of 12 dogs, so roughly 75%, had resolution of diarrhea within the first 48 hours. And then they did typically have better resolution within 72 hours. And it's basically based on the Purina fecal scoring system is how they determined resolution. So basically soft stools, they could form to soft stools. So they could still kind of have like a cow patty appearance, and they considered that resolution compared to like the watery diarrhea that we often see.
And it's a 3-day course, typically. Is that right?
Currently, yes. I mean, that's what it's listed as. With some of the studies they've done, some of the patients didn't actually reach resolution until later. But the way that it's labeled currently is for a 3-day use. Whether that is extended is a potential. And this is conditional FDA approval. And that conditional approval is actually based on efficacy trials. So some of that may change as they do more of those trials and how long can we use this, that sort of thing. The safety trials look pretty good, though. The adverse effects between control groups and groups that were treated with Cannilivia, or specifically the active ingredient crofelemer, were actually pretty similar. And they did 2 types of studies for that. They did one where you had non-clinical patients and they were given crofelemer. And then there was also a study with actual patients that were having diarrhea from different causes. And they were... Both of those studies had pretty similar adverse effects between the control groups and Cannilivia.
Who is the manufacturer of Canalevia?
Jaguar Health is the manufacturer.
Okay, cool. And so what's the form? How is this given? How is it administered?
So they are delayed release tablets. And so we don't want our patients to chew on them. They should just be swallowed whole. We don't want our clients splitting or crushing them to be able to get them into the patient. So that is definitely something to keep in mind when we're talking about administration and choosing our patients for this medication. It typically comes in a bottle that contains 60 125 milligram delayed release tablets. And dosing is 140 pounds or less would get 1 tablet twice a day for 3 days. And if they're greater than 140 pounds, they would get 2 tablets twice a day for 3 days.
God, I love that dosing. Can everything have that dosing? It's so great. It's like human medicine dosing. But very quickly, I just looked up Jaguar Health, and surprisingly, they only have 2 products. One is Cannilivia, and 2 is Mytisia, which is the human form of that. So their thing is powerful plant-based prescription medicines, which I think is interesting. So cool.
Very cool. These are 3 great products that I guess Nu-Q is already available, but Solensia and Cannilivia coming soon to a practice near you.
Yeah. Is there anything else, Anita, about Cannilivia that was intriguing to you or that we should know?
I think it's just nice to have something that's locally active and specific for chemotherapy-induced diarrhea. You know, even in general practice, if we're not doing chemotherapy, a lot of times we're managing these patients. We're doing their CBC rechecks. We are seeing them when they're not doing well because their oncologist is an hour away or at a university that's not in the same city. So it's nice to have a product that we're not going to be as worried about having systemic side effects or adverse effects and that sort of thing. So I think it's exciting.
Yeah. Yeah, that's a great point.
Were the side effects mainly just like GI related side effects?
So there's adverse effects that were listed, and these applied both to control groups and the group that got the crofelemer, but decreased appetite, attitude was depressed, decreased activity, dehydration was one of them, but that was also in the study where they were having diarrhea. So that probably is affecting it. And then abdominal palpation indicated pain, and vomiting were the side effects or adverse effects looked at.
And that's so tough because you don't know if that's just because, they're having diarrhea.
Right.
Or the underlying cause. Yeah. Interesting. Okay.
I just wanted to bring attention to one other drug that hit the market this year. It's called Clevor. And Marisa, you know a lot about Clevor. I know we're not going to talk about it today because we talked about it back in episode 10. So everybody listening should go back and listen to that one. It was great. Do you want to just give a quick summary of that?
I guess I'll give a quick update because when I talked about it the first time, I had never personally used it. Yes. So you guys should see Clevor out right now. Clevor is the first and only FDA approved emetic for dogs. So something to make them vomit that's not apomorphine. So you don't have to compound it. You don't have to inject it. It actually comes in drop form and you put it in their eye, just like we used to put those apoconjunctival tablets in their eye. But this is actually just an eyedropper. The dosing is based on weight, and there's an awesome graph in the insert based on, my dog is 55 pounds, so she got 2 drops in her eye, which leads me to the next part of the story, which is I've personally used this since talking about it, and it's actually very reasonably priced. Most manufacturers, the cost of it for 5 doses is $110. What's that, $23 a dose plus, the markup that any hospital would have. So it's probably, $50 to $75 treatment, which I thought was awesome. And it says usually a dog should vomit within 20 minutes. My dog, who should know better, ate part of a quilt. And I was like, I have this whole box of Clevor here because, I wanted to try it. And she vomited in 8 minutes. She vomited 4 times and all of the quilt came out. So I have had a very successful time with Clevor, and I will say the hospitals
totally worth the money.
Exactly, it's totally worth the money. The hospitals I've been to, I haven't seen it yet. Have you guys seen it in any hospitals?
I haven't.
Not even in ER, Anita?
No.
Interesting. Yeah, I'm sure it's more expensive than APO, especially compounded APO. But this Clevor is interesting, and I will say one of the reasons why I think people may not be carrying it is because the way it works is it's actually a dopamine agonist. And so the way to actually reverse it, we normally give Serenia or something to that nature when we're giving APO, but you can't use Serenia to reverse Clevor. You have to use metoclopramide. So Reglan. And that may be tough because the hospital may not have that. And so that's just something to keep in mind that's different.
When you used it, did you reverse anything? Or did you just let her puke?
Oh, actually, that's not true. I had metoclopramide tablets, so I shoved 10 milligrams down her throat. But since then, I have ordered injectable Reglan. So that lives in my fridge. Oh, wow. And
always prepared.
Knock on wood, she hasn't eaten anything since. So
she learned her lesson. Great. She didn't want any more drops in her eye.
Well, probably not. But yeah, Clevor is definitely out there. I recommend using it.
Well, for more info on that one, definitely check out episode 10. It's called Making Dogs Puke.
Nice.
You'll find it there. All right. Well, I think that we try to keep these things short. So that brings us to the end. I want to thank our guests today. Thank you so much for taking the time.
Our 3 experts.
Experts, absolutely. Thank you for doing all that research and for joining us today.
Kelly, you did awesome. Anita, you did awesome. Amy, you're always. You guys are so smart. We hope you enjoyed this episode on the IndeVets Happy Hour. Thank you for listening. Tell your friends, and if you like us, leave us a 5-star review and make sure to subscribe so you can be alerted whenever we have a new episode. If you have questions, comments, or suggestions for future episodes, you can email us at clinical@indevets.com. Also, to learn more about us and how we're making vet med better, head to indevets.com. That's INDEVETS.com. While you're there, be sure to head to our blog for the latest stories and tips from our doctors. And lastly, if you're interested in joining our amazing IndeVets team, please email Dr. Andrew Heller at andrew@indevets.com. See you next time. Cheers.
Cheers.